privilege to have the Health Secretary in the studio for us this morning, Mr. Hancock. Good to see you. Last time you were here, it wasn't this fancy new set, it was the old one. You've got a fancy new app. How does it behave as opposed to the old one? Why is it so much better?
Well, we're launching today, for the first time, the COVID-19 app for England and Wales. This is going to be a helpful tool to help all of us to tackle the virus. And it does the core job of ensuring that if you've been in close contact with somebody who's tested positive, then you will be notified. But it also will allow us to click on a QR code, for instance, when you go to a restaurant, and to also find out what the rules are in your area, because we're increasingly using local action in parts of the country where we need to take stronger action, so it's got the details of that. So it's an information device. It helps you to record where you've been, which is important for contact tracing, and it has the core capability of letting you know if you've been in close contact with somebody who's tested positive.
What percentage of the population needs to download it in order for it to be effective? Well,
there isn't a figure for that. Every single person who downloads the app is helping to improve how it can keep us safe. It helps you to keep yourself and your loved ones safe, and every additional person downloading it will make the country a safer place.
Yeah, but if only 4% of the population download it, it's not going to work, is it? So you must have a number.
No, on the contrary. Even if only 2 people downloaded it and they came into close contact and one had tested positive, then it would work for the other. So the more people, it's true that, of course, the more people who download it, the more effective it will be. But this is just one part of our overall plan for tackling coronavirus,
sure,
of course. And so the more people who download it, the more effective.
But according to a report in this morning's Times, 30% of test results give false positives. So 30% of people could be self-isolating who don't need to.
Well, that's not quite right, because the app will only tell you to self-isolate if you've been in close contact with somebody who's tested positive.
Yeah, but they could be false positives.
Well, you will have had to be in close contact with somebody for it to tell you to self-isolate. So there is the question of how long you've been in that close contact is something where we're constantly improving the accuracy. But if you download the app and it comes up and tells you to self-isolate, that is because you will have been in close contact with somebody.
Yeah, but their test in itself might have been a false positive.
No, only if... no, the tests that we have an incredibly high specificity.
So this article in the Times this morning is wrong?
Well, the question is, how close do you have to be for how long? And the app will not tell you that you have to self-isolate unless you have been in close contact with someone. We have...
Who in turn might have had a false positive. You know, they might have gone to have a test and they're told it's positive and it's not. And so people around them are being told to isolate for a fortnight and they don't need to.
But the proportion of people for whom the test gives a positive when they haven't had coronavirus is very, very small. That's
so
that's under 1%.
Correct, that story. That 30% story
figure
is not correct. OK. Where are we as far as testing is concerned? Apparently, positive tests up a quarter yesterday. Boris Johnson keeps telling us that we're testing more than any other European country. How does it help?
Oh, well, the massive testing capability that we've got helps to find where the virus is. So if you think about it, yesterday we had a figure that there's over 6,000 people who've tested positive in the previous 24 hours. And that, as you said in the report, is comparable to the highest levels in the peak in terms of the number of people who were tested positive. But back then, we estimate through surveys that over 100,000 people a day were catching the disease, but we only found around 6,000 of them, and they tested positive. Now we estimate that it's under 10,000 people a day getting the disease. That's too high, but it's still much lower than in the peak. And through the mass testing that we have, the capacity, 250,000 capacity that we have, we found yesterday over 6,000 of them. And that then allows us to and do the contact tracing for everybody who tests positive and find who they've been in contact with.
Okay.
And in addition, from today with the app, if you download the app, you'll also have that added protection for you and your loved ones.
Okay, 124 of those were at Glasgow University. One wonders why you are focusing particularly on pubs with a 10 p.m. pub curfew when actually it's kids gathering in universities or schools where the 21% of outbreaks are amongst school children and universities, only 5% in food outlets, which is pubs. So aren't we targeting the wrong areas?
Well, no. If you look at the information that we get from contact tracing, because we are in contact with all of those 6,000 people who test positive, we try to get in contact with all of them, and we get in contact with around 80% of them. And so we can find out where they've been having contacts. And we know that the most likely place is in your household, and that's why in the areas...
And not in pubs.
And then in social settings.
But not according to Public Health England's figures. 729 outbreaks to the week ending 13th of September, 5% in food outlets, which includes pubs and restaurants, 21% in schools, 45% in care homes.
Well, that's a slightly different measure. That's a measure of where there are outbreaks. So, for instance, if a school has a suspected case, then they will call Public Health England in England, or they'll call the public health authorities in Scotland, for instance, the University of Glasgow example. And that is then put down as an outbreak. That is different to measuring by contacting all the people who've tested positive and finding out where they have had close contacts. That way, we find where most of the contacts come.
It's very complicated, isn't it? And,
well,
I mean, the problem is that we're concentrating on the scientists and not the economists. And as a result, tens of thousands of people, hundreds of thousands of people are going to lose their jobs. What is your colleague, Rishi Sunak, going to do today to protect those jobs?
Well, throughout this, Kay, we have put enormous amounts of effort into protecting the economy and people's jobs.
Yeah, but what are we doing going forward?
Well, the Chancellor is going to set out the details in the House of Commons later, and I'll let him do that. Is it going to be
more targeted?
Well, what you've seen is over the past 9 months since this crisis started, you've seen an unprecedented amount of economic support to keep jobs going, to support businesses who have been terribly hit by this. And we're determined that that should continue. So in the same way that in the last couple of weeks I've set out a winter plan for the NHS, a winter plan for social care, the Chancellor will be setting out the winter plan for the economy to support the economy going through this. Look, the whole principle of our approach...
It needs to be more targeted, though, doesn't it, now? You know, it was blanket support in March and early April that we heard. That cannot continue because we will be keeping people in jobs where the jobs, we're just propping them up against the window, basically. We need to be much more targeted. And areas like the aviation industry is literally on its knees, again, with the hospitality industry.
Well, if you think...
It's going to have to help them specifically.
Well, the health measures that we're taking are more targeted than they were.
Yeah, I'm asking
before.
you about your colleague.
I know, and he's going to. I know, and he's going to set out the details later. But what I'd say is that our whole strategy is to suppress the virus whilst protecting education and the economy. And the amount of work that's gone into ensuring that schools can go back, that has gone successfully, and we protect people in schools, including with the outbreak management that we were just talking about. And the Chancellor has done, I think, unprecedented amounts to support the economy, and he'll be setting out the next steps later.
Can you acknowledge, at least, that it's only just in the nick of time that you are moving into place, some might say too late, to protect jobs, given the numbers that we're looking at, 695,000 fewer people employed in August compared to March?
Well, we've said throughout that, sadly, we're not able to protect every job and every business. But I think in terms of the timing of this, we've been working on the winter plan for the economy and options in case cases started to go up again since the summer. And with the Prime Minister having set out the next steps in terms of on the health side on Tuesday, now the Chancellor is coming to the House on today, 2 days later, to set out the economic package,
I
the
understand
winter
that,
plan that
but
goes
you know,
with that.
my viewers watching this morning very keen when you were on. Lots of messages saying, "Can you ask him this? Can you ask him that?" A lot of people worried about their jobs. Of
Yes,
course, they're worried about
I
their health,
understand that.
but they're worried about their jobs,
Yeah.
and they need to know as they rush out the door this morning. Will they still have a job in a month's time? And in order to do that, they need support from the government, not just health support from you, but also
That's right.
from your colleague Rishi Sunak.
That's right.
Is it going to be targeted support for people like the aviation industry and people like the hospitality industry and the nighttime industry? If you don't support them, very soon there will not be a nightclub to go to or a pub to go to or a plane to get on.
Well, as I say, the health measures we're taking have been more targeted, both regionally or locally, or depending on where the virus is spreading fastest, and in terms of the parts of life that we are having to put rules in place for to try to restrict the spread.
I understand.
And I totally understand the challenges on the economic front. I mean, that's my background before I came into politics. I totally understand that, and the Chancellor and I work incredibly closely together on this.
So you know what he's going to say.
And actually, he comes from an NHS background. I come from a small business background. We understand where both the economic and the health impacts
Have
are
you given him
both
advice?
important. Well, look, we talk all the time, but the Chancellor will set out the details later today. We'll have to. Let's wait until then to see the details of it. But the principle is really clear, which is that we'll support as much as is feasibly possible people through these, what we know are very difficult
will go,
times.
as we can see. Two quick questions before I let you go. Apparently, there are problems with the flu vaccine, not enough flu vaccines available, and so chemists and GP surgeries are having to ration them. Is that right?
Well, we have record amounts of flu vaccine in the country. I'm also very pleased to see that having launched the flu programme this week, we have record amounts of demand for it. That is a very good thing. And in the first instance, the flu vaccine must go to the clinically most vulnerable, which is the over 65s and those with other health conditions.
But in answer to my question.
But then we intend to roll it out more broadly after that.
Yeah, but do we have enough?
We've got more than we've ever had before.
Do we have enough?
Well, if we have 30 million doses. And
do we have enough?
Well, I'm answering the question. We have 30 million doses. That is more than enough for all the people who are vulnerable, specifically vulnerable to flu, to get their doses. And once we have got the doses as much as possible to the most vulnerable, then we will roll it out to others, for instance, of working age.
And you'll have more supplies by then?
We've got the record amount of supplies, but you'll totally understand, Kay, that given that we have 30 million doses, I want to make sure that they are available to the people for whom flu can be can kill. And after that, we'll make it available to those, for instance, of working age.
Interesting, because, I mean, Dominic Raab sat here yesterday and he said he was having his flu jab on Friday. I mean, I'm guessing he's not particularly vulnerable.
Well, lots of people are able to get flu jabs, and if they're in the categories that are available, where they're available.
I think he's high risk, but there we are. Yeah, he'll have to answer for that. And very quickly, before I let you go, maybe you'll need to cover the children's ears at home this morning. How long is this casual sex ban going to last? You're saying that no social distancing needed in established relationships. What about people who are not in an established relationship? Why am I whispering? I don't know.
I don't know. You're live on national TV,
Indeed.
Look, there are.
It's OK to smile.
In these rules that we have to bring in, you have to have. There have to be boundaries, to coin a phrase. That we have to. If you're saying that two households shouldn't mix, which we are in some parts of the country, in the northeast, the northwest, in Scotland, in parts of Wales, then you have to then define what is the boundary of that, and that does lead to some.
That's my question. I mean, established relationship. Does that mean if I say I love you? I mean, because some people say that and they don't mean it. But are you in an established relationship then? I don't know. I
think we should stick to the letter of it, which is that it's OK in an established relationship.
And what does that mean to you? I mean, I know what it means to you and Mrs. Hancock.
That was exactly how I was going to answer. Yeah. I know that I'm in an established relationship.
OK. What about other people watching this morning? How would you define an established relationship?
I think people, it just means that people need to be careful, right? People need to be sensible. And if you're in a relationship that is that is well established, you know, that's what
that
it
like
means.
6 months?
What it means is people realizing that
When you've had dinner?
by coming into close contact with people
Twice?
in other households, then that is how the virus spreads. And I just come back to the first principles, right? Which is we all want to keep this virus under control. We all need to play our part. And playing our part involves following the social distancing rules and, from today, downloading the app. That is part of doing your bit. And it means abiding by these rules in their letter and their spirit. And if we all do that, then we'll get through this as best we possibly can.
And you've body swerved the established relationship, haven't you? Because you don't really know what that means. Anybody can bend the rules on that, can't they?
I wouldn't suggest that. I wouldn't suggest bending the rules. I would suggest sticking to them letter and spirit.
OK, it's good to see you. Thank you very much indeed for joining us. Doing a great job. Thanks a lot.